if you had a lot of belly pain, nausea, vomiting, if you were just really sick to your stomach and your parents were really, really worried about you, they might run you over to an emergency room. And one of the first things they would do at this emergency room would be to put you through an exam called a CAT scan, also called a computed tomography exam or a CT. That would be one of the basic tests they would do to try and figure out what was making you so sick. If you were going to get one of these exams, they would probably stick you with a needle first and get what's called an IV line set up, and then walk you over and have you lay down on a special table that goes up and down and in and out in front of this giant thing that looks sort of like a donut. It has this big hole in the middle and it's kind of round outside. And they would put you on the table, get you nice and comfortable, and give you some instructions, usually maybe to hold your breath, maybe to hold still, to do a certain thing, and sort of warn you the table's going to move in and out, and at a certain time you're going to feel this stuff come through this IV line. It usually feels very warm. Sometimes people really start squirming because it hits different parts of their body at different times. But it's usually pretty fast. The whole exam is usually over in 5 or 10 minutes, and there's no pain, can't see anything. It's just you hear whirring noises and the table moves in and out, and then it's all over. Yeah, the end result is what's called cross-sectional images. So kind of right across, if you were getting your belly scanned, they would be looking at images right through your belly, as if they had taken a pretend chainsaw and just cut you in half and looked and peeked and then put you back together, kind of a thing. So they're looking cross-sectionally at all the organs and tissues in that particular plane. And then they do that usually up and down a specific length, depending on what it is they're looking for and what they're worried about.